Coronary artery disease is basically disease in the plumbing supply of the heart. Coronary artery disease typically happens in Indians much more commonly than in the rest of the world. What leads to a problem in the plumbing supply of the heart? This is a combination of our genes, of our lifestyle, as well as the environment. Now, your genes, you can't do much about it. Your lifestyle, you certainly have control over it. And of course, the environment, right? I mean, you don't want to be exposed to a very polluted environment. You don't want to, be around people that smoke a lot because that's basically what is passive smoking. Now, with regards to the lifestyle, there's a lot to be done. So we talked about lifestyle and heart disease. So what can you do to improve your heart health? It's actually not that hard. You got to focus on the basics. What you eat, which is your diet. This is very, very important and forms really the basis for how likely you are to get heart disease. You should also focus on your sleep. Make sure you get at least 6 to 7 hours of sleep, 7 ideally, and in a regular manner, not like weekends or partying and weekdays where you try and sleep early. So make sure your sleep is in a consistent pattern. Then for sure, make sure you get at least 30 to 45 minutes of moderate intensity exercise every day, or at least 5 out of 7 days. The other important thing is that if you do happen to have some of the risk factors for heart disease, and what are those? Diabetes, hypertension, high cholesterol, you absolutely should keep these under control. So work in conjunction with your doctor to manage your risk factors better. In fact, every person over the age of 20 should have their cholesterol checked. Did you know that? Now, the other important thing that is actually often underemphasized is social connection. It is important for people to have a good, good community of friends, family, whatever. People that you can relate to and have good social connections. And I don't mean just on the phone, but in the real world, people that you can talk to. This is very important and has been shown in studies to be an independent predictor of your heart health. And last but not least, I'm going to state the obvious, definitely do not smoke. Vaping still puts you at a higher risk for heart disease. So if you have any of those habits, you have to give that up. So these are some simple things that you can do to improve your heart health and reduce your chance of having heart attacks, which is the #1 killer globally and in India of men and women.